Let's set the stage with a simple scenario. I want you to do something for me. Don't think about white bear. That's right. Don't think about it. If you're like most people, you're probably picturing a white bear at this very moment. Why is that? Well, this is a perfect example of ironic process theory, also known as the white bear effect, which comes from a famous study by psychologist Daniel Wegner in the 1980s. So, what's really going on here? Ironic process theory explains that when we actively try to suppress a thought, our brain splits into two processes. The first process is the conscious effort to lock the unwanted thought away. It's like the guard at the gate of your mind, actively saying, "Nope, you can't come in here." But then there's the second process. This one is subconscious, and it's a kind of monitoring system that checks to make sure you're not thinking about the forbidden thought. The ironic twist is that in order to check if you're not thinking about something, your brain has to briefly open the door to that thought to check. It's like asking, "Am I thinking about a white bear right now?" Which of course makes you think about it. This mental tug-of-war creates a paradox. The harder you try not to think about something, the more you end up thinking about it. This paradox plays a part when someone tries to suppress the thoughts of trauma, according to Ehler and Clark. So, what's the takeaway here? For trauma and some other disorders, such as OCD and anxiety, suppression isn't the answer. It's actually part of the problem. Instead, therapies like cognitive behavioral therapy or trauma-focused therapies often encourage acceptance. By confronting intrusive thoughts or memories in a safe, structured way, people can reduce their power and break the cycle of suppression.